Good day, everyone. My name is Dr Chinoyerem. I'm from Trucare Fertility Clinic. We're going to be talking about male factor infertility today. Okay, so male factor infertility is defined by the presence of more than one abnormalities in semen analysis or the presence of inadequate sexual or ejaculatory function. Male factor infertility contributes to about 30% of infertility in couples. Okay, so there are a couple of them. It can be caused by smoking, heavy use of alcohol, obesity, exposure to pesticides, exposure or people who work in chemical companies, use of sauna, bath, and use of recreational drugs. Anything that would affect spermatogenesis, like that's the process of sperm production, at any of the stages will cause male factor infertility. So it could be from the higher centers, which could be from macroadenomas, tumors like macroadenomas. It could also be caused by hereditary factors like cystic fibrosis, carcinogenous syndrome. It could also be caused by medical conditions, people who are on antidepressants, cimetidine, people who are diabetic. The drugs used could affect the sperm motility. It could also be caused by previous surgeries. Any surgery in the groin area. It could be caused by dilatation of the veins of the testicles, which we call varicocele. It could be caused by testicular tumors. Any sperm count that is less than 15 million is known as low sperm count. So when a man has a seminal analysis done, there's some stuff we look out for. We look at the volume. The volume should be up to 1.5 mils. A seminal fluid analysis is usually done after 2 days of abstinence from sexual intercourse. So on the 3rd day of abstinence, the semen analysis will be done. So the ejaculate that the man presents, there are some parameters which are actually looked out for. The volume, which should be up to 1.5 mils. If it's less than that, it's low. So we also check out for the sperm concentration. The count should be up to 15 million. We look at the normal forms. We expect to see 4 in every 100. We look at the motility. The motility should be up to 32% and above. We also look at the viscosity. The viscosity should be normal. When the viscosity is high, it shows that it could reduce the motility of the sperm cells because sperm moves freely in liquid that are lighter than when it's thick. Just imagine a fish swimming in water and a muddy water. Okay, so by recreational drugs, I mean marijuana, cocaine. Such drugs affect what the count and the motility of sperm cells, which will further reduce the count in males. Okay, so first of all, it could be caused by trauma. It could also be caused by during surgery around the groin region or the pelvis. It could also be caused, I don't know if you've heard about of undescended testicles. When the testicles are seen in the abdomen, usually before birth, the testicles should descend down into the groin, like into the scrotum. But if they persist in the abdomen, then they have to be taken back to the scrotum. So during such surgeries like inguinal hernias, there could be a damage. It could also be caused by infections like chlamydia, gonorrhea. But so first of all, we usually make a diagnosis to find out the cause of infertility in the couple. So we usually ask for a hormonal assay. We ask for a seminal fluid analysis. So from the seminal fluid analysis, we could make a diagnosis to state, oh, the sperm count is low, or we have a low motility, we have abnormal forms, we have, from the morphology, you could have less than 4. So when we make that diagnosis, or we could also make a diagnosis of no sperm cells at all. So if we have a result of a seminal fluid analysis done, what we would then do is to counsel the couple on what to do. We usually do IVF for people who have a count of less than 15 million. We usually do ICSI. ICSI means intracytoplasmic sperm injection. What we do is to inject the sperm directly into the eggs. For a man to get the wife pregnant naturally, about 15 million sperm cells have to surround a single egg. But in IVF, what we do is to pick up one good healthy sperm and inject directly into the egg. So by the next day, we expect fertilization to take place. So with that, people with count that are less than normal will be able to achieve pregnancy. Also, if we see there are no sperm cells, we could do some procedures to actually find out whether it's obstructive. Whether it's obstructive. Obstructive means that sperm cells are being produced, but they are not being released. So we do procedures like TISA. TISA means testicular sperm aspiration. Here we aspirate sperm cells. We aspirate semen and look for sperm cells. If we see sperm cells, we inject it directly into the eggs. And then if we find out that it's not obstructive or there are no sperm cells, we would counsel on donor sperm. Male factor infertility is treatable. So don't stay back at home. There's solutions. So ensure you go see your doctor for a check, and then you will be properly diagnosed, and we'll take it off from there. Thank you for watching us. My name is Dr. Chinoyerem. See you some other time.